Thank you, Senator Hassan, for your questions. The good news for all of you is I think I'm the last person, but I have a few questions that I wanted to ask Ms. Regg. Let me start with you. Medicare Advantage plans have grown in popularity in recent years. Over 50% of Colorado seniors have selected MA plans over traditional Medicare. While this private insurance provides seniors with more options, we need to provide appropriate oversight and protect seniors from deceptive marketing and properly steward taxpayer dollars, and I think that's why we're all here today. I've heard from hospitals across Colorado, like the San Luis Valley Health, about the challenges they face to get their patients timely care with Medicare Advantage plans. Consistently, hospitals and their patients experience hospital admission denials, delays in care, and plans refusing to pay after they've approved a service. In fact, the head of San Luis Valley Health, Connie Martin, told me that in the past 6 months, the hospital has made 45 hospital admissions requests from MA plans, and every single one of them was denied. This is in stark contrast to a 93% approval number across other private non-Medicare plans. This is utterly unacceptable, and I plan to follow up with the plans directly, I have that plan. We have to follow up with the plans, and she was actually quite specific about who the folks were, and I think we're going to have a conversation. But our seniors deserve better than this. Coloradans with Medicare Advantage consistently tell me that that their surgeries are delayed, often for months, that they were lied to about their level of coverage, or that their plan was too expensive, and that their claims are denied when they're told services, should have been or would have been covered. All of this demonstrates, I think, that we need greater transparency. And so, Ms. Regg, as a director of a state insurance department, do you have access to Medicare Advantage plan denial rates or approval turnaround times? And if you had access to that data, how would that change your ability to guide seniors toward the plan that is best for them and their health care needs?
Thank you, Senator. At this current time, no, we do not have access to that level of information. Having access to that detailed information and accuracy rate would greatly help us in choosing plans for consumers and allowing them to have confidence and peace of mind when enrolling into those plans.
Thank you for that answer. And I've got a follow-up question for you, Ms. Regg. Coloradans with Medicare Advantage plans often don't recognize that their private plans don't cover their doctors until it's too late. In 2018, the Centers for Medicare and Medicaid Services reviewed 52 Medicare Advantage plan directories and found that over a third of providers were erroneously included, either because the provider did not work at the listed location or because the provider was out of the plan's network. These are often known as ghost networks. Ghost networks make it difficult for a beneficiary to determine if their doctors are in network at all, and this misinformation often leads to unexpected and higher out-of-pocket costs for Colorado seniors. And that's why I've worked with my colleagues, Senator Ron Wyden and Senator Tom Tillis, to introduce the Real Health Providers Act, which will strengthen requirements for these private Medicare Advantage plans to maintain adequate provider directories. It would also ensure seniors do not pay out-of-network costs for appointments with doctors who were inaccurately listed out of network. Ms. Regg, when you help counsel seniors, as I know you do, how important is it for them to know that their current doctors are actually in the network? And do you feel confident telling them that the provider directories they rely on are accurate?
And network information is vital to choosing a plan. As shared earlier, no, we don't rely on the directory or even the plan finder linked to the company's website page. We use that as a springboard for them to work directly with their provider offices to see if they are in specific Medicare Advantage plans. Network information, not just in network versus out of network, but also knowing if there's a prior authorization to utilize specialists, are hurdles that we often go over with Medicare beneficiaries.
I do think, I'm at an end, so I'm not going to ask my third question. I'll submit it for the record. But I appreciate your testimony very much. To me, this is just one more place where seniors are having to spend their golden years fighting, 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 just to get the health care that people in other countries, have relied on. And that's when it comes to Medicare, which is something that people generally, I think, feel pretty good about in our country. So thank you. We're going to fix this problem, and I really appreciate your testimony here today.